There is no doubt that high levels of stress are implicated in large amounts of lost productivity and poor health. So if you're a manager, how do you go about managing the stress of your team? Our default in managing stress is reactive. If an individual complains of being overstressed, the matter is investigated and appropriate measures are taken. Options include adjustment to tasks, information systems or paid sick leave. Organisations have a legal obligation to manage the work-related stress their employees are exposed to. The Health and Safety Executive recommend a more proactive approach, which is referred to as risk management. This involves actively looking for reducible stress problems rather than waiting till they are reported, diagnosing the cause and then intervening to reduce the risk of stress. Stressors should be assessed and, where reasonable, be reduced. This approach to stress management was used in a well-funded research programme in several NHS hospitals. It showed benefits in self-reported stress rather than more objective measures of patient outcomes, staff turnover and absenteeism. However, the approach is subject to several limitations. There is significant evidence of confirmation biases in the completion of psychometric assessments, and for example, the self-reported rates of post-traumatic stress disorder are much higher than those based on expert clinical assessment. Where stress is found, there will be a requirement to do something about it. There is no guarantee that those actions will have the required benefit other than providing resources for tasks clearly underprovided for. Wherever stress management is implemented, costs can be expected and the benefits can be difficult to measure. Secondly, the effectiveness of assessment and change programmes like this are dependent on finding issues that cause stress and are correctable. The pilot research identified certain manageable difficulties, such as staff shortages or lack of administrative time. In a reasonably competently managed organisation, most of these will be spotted and corrected automatically. Consequently, as with many management interventions, stress management is most effective when the organisation is most dysfunctional. Thirdly, there is the difficulty of identifying triggers for such risk assessment. Triggers such as an unusually high turnover or absenteeism are reasonable, but the intervention has not been demonstrated to improve these things. On the other hand, triggers such as self-reported stress levels or their equivalent would lead to widespread application with considerable associated costs. This demonstrates the limitations of the standard approach to stress management. Therefore, a cultural model of stress management may be more effective, in which stress is not looked at in isolation, but is incorporated into human factors training more generally. The issues of teamwork, leadership and communication all have direct bearings on levels of stress, and understanding the importance of stress adds motivation to improve performance in those same areas. Specific issues that the study of stress brings to those topics are that frequently there is little we can do to control the stresses we personally experience, but we can control what resources are available to deal with it. Another important point is that while we may have little control over the stresses we personally experience, we frequently have greater control over the stresses of those around us. With appropriate teamwork, leadership and communication skills, we can work with those around us to reduce the stress we all experience far more effectively than anything we can achieve as individuals. One final thing to remember is it's difficult to reduce the stress imposed on you by those around you, but easy to reduce the stress you impose on them.